All right. So, hello everyone, and thank you for taking the time out of your day to join me for this presentation. So, today's topic is going to be on Diabetes Awareness Month, as November is Diabetes Awareness Month. So, today we'll be going through, here is our agenda. We'll be going through some stats, some signs and symptoms of diabetes. We'll look at different types of diabetes, discuss diabetic risk factors, talk about ideal blood sugar ranges and other lab tests, and we'll go over ways to manage and prevent diabetes. Also, look at some myths and facts, and talk about how Symbol is here to help with your diabetic concerns and needs. So, let's get started. So, to start with, what is diabetes? So, diabetes is when your blood sugar or glucose is too high. It develops when your pancreas doesn't make enough insulin or any at all, or when your body isn't responding to the effects of insulin properly. So, how common do you think diabetes is? So, diabetes isn't just a chronic disease, it's an epidemic. It affects 38 million Americans. So, that is one in every 10 people in the United States, with one in every five of those individuals not even knowing that they have it. In addition to that, 97.6 million of American adults are living with prediabetes. So that's more than one in three people, with more than eight out of those 10 people not knowing that they have prediabetes. So, hitting a little closer to home, Alabama has the fourth highest population of adults with diabetes in the United States, with 15% of the overall population being diagnosed. So that equates to approximately 593,500 adults. So, what are some signs and symptoms for diabetes to be on the lookout for? So, these can include feeling more thirsty than usual, urinating more often, feeling tired and weak, having blurry vision, having slow healing sores, having very dry skin, numbness or tingling in your hands and feet, frequent skin or vaginal yeast infections, or an increased appetite. Some people can experience no symptoms at all, which is why testing and awareness is so important. So, if you're currently experiencing any of these symptoms, I recommend reaching out to your healthcare provider. So, next we'll go over the different types of diabetes. So, we'll start with type 1. Type 1 diabetes is an autoimmune disease in which your autoimmune system attacks and destroys insulin producing cells in your pancreas for unknown reasons. It's usually diagnosed in children and young adults, but it can develop at any age. Type 1 diabetics actually only account for 5 to 10% of all diagnosed diabetes cases. Next is type 2 diabetes. So, type 2 diabetes is when the cells in your body don't use insulin properly. The pancreas may be making the insulin, but it's not making enough insulin to keep your blood sugar in a normal range. Type 2 diabetes is the most common form of diabetes. And then we also have prediabetes. So, this is the stage right before type 2 diabetes. This means your blood sugar levels are higher than normal, but not high enough to be officially diagnosed with type 2 diabetes. 70% of people with prediabetes end up developing type 2 diabetes at some point in their lives. So, this stage can be changed through lifestyle changes to avoid that progression. Another form of diabetes is gestational diabetes, which is having an elevated blood sugar during pregnancy. Typically, this condition goes away after birth, but almost 50% of women who are diagnosed with gestational diabetes develop type 2 diabetes later in life. So there's no known cause for type 1 diabetes, but there are some risk factors that we do know of that put you at a greater risk for developing type 2 diabetes. So some of those are being overweight or having obesity. So obesity is linked to up to 53% of new cases of type 2 diabetes every year, being age 35 or older. So children and teens can develop type 2 diabetes, but their risk increases as a person gets older. Having a history of gestational diabetes, like I mentioned earlier, or giving birth to a baby weighing more than 9 pounds. If you are African American, American Indian, Asian American, Hispanic Latino, or Pacific Islander, you are at a greater risk. And also if you're not physically active. So whether that be from physical limitations, a sedentary lifestyle, or a job that requires you to sit for long periods of time. Also, if you have prediabetes or if you have a family history of diabetes. So unfortunately, some of these risk factors are not in our control, like race and age. So it's important to focus on the things that we can control, like our lifestyle. So if you've gone through a simple biometric screening, then you have had your blood sugar checked. So checking your blood sugar tells you how much glucose or sugar is in your blood at that moment. So for people with diabetes, the standard blood sugar range is the same regardless of your age or health condition. However, a doctor may set different goals based on your specific circumstances. For instance, if you're at a higher risk for diabetes, your doctor might want to see your blood sugar levels in a tighter range. So the recommended blood sugar ranges if you don't have diabetes are if you're fasting, so before eating a meal, we're looking to see it at 99 or below. And then 2 hours after having a meal, we're ideally looking to see that under 140. So according to the American Diabetes Association, these ranges are recommended for adults with either type 1 or type 2 diabetes and children with type 2. So if you're currently diagnosed fasting, so before eating, we're looking to see that number between 80 and 130. And then 2 hours after a meal, we're looking to see that under 180. So you might think, if I'm diabetic, why should I regularly check my blood sugar? Well, measuring your blood sugar can help with many things. So it can help monitor how medications are impacting your sugar levels can also help determine how different meals and food choices impact your blood sugar. It can determine whether exercise or other lifestyle changes are impacting those sugar levels. It can also help keep track of your overall progress. So even if you don't have diabetes, it's a good idea to get your blood sugar checked periodically. A doctor might order a blood sugar test as part of an annual physical. So if you have any risk factors for diabetes, you may need to get your blood sugar checked more often. So now we'll talk about another lab test that is also used to monitor and diagnose diabetes. So another common test used is an A1C. So when we check our blood sugar at home or at your doctor's office, it's just a snapshot at that single point in time. But your blood sugar constantly changes. So this doesn't give you a complete picture. The A1C test measures your average blood sugar levels over the past 3 months. So the CDC recommends that adults over the age of 45 have an A1C test done to assess their risk of prediabetes or diabetes. If you have any diabetic risk factors, your healthcare provider may complete that test before that age. Having an A1C test completed helps your healthcare provider detect prediabetes early, to counsel on lifestyle changes, and to help delay or prevent type 2 diabetes. It can also determine if you have type 2 diabetes, and it can also help monitor your diabetes and help make treatment decisions. So what do the different ranges of your A1C mean? So here in our table, we can see normal levels. We're looking for that to be below 5.7. So between 5.7 and 6.4 is considered the pre-diabetic range. And then an A1C of 6.5 or above is considered diabetic. So what are some of the things that affect those numbers and can cause them to increase? So, first, eating more carbohydrates. Consuming more than a typical amount of carbohydrates from meals or snacks. Foods high in sugar, processed grains, and certain starchy foods can cause that spike. Dehydration. Not drinking enough water or fluids can increase your blood sugar. Stress. Emotional stress releases hormones like cortisol and glucagon, which raise your blood sugar. Losing sleep. So, even just one night of too little sleep can make your body use insulin less well. Also, illness. Being sick, even with something like a cold, can increase your blood sugar levels. Also, certain medications. So, these can look like corticosteroids, diuretics, or other medications that are used to help control high blood pressure can increase your sugar levels. Skipping breakfast. Going without that morning meal can increase your blood sugar after both lunch and dinner. And the time of day. So it can get a little harder to control your blood sugar as a diabetic as the day goes on. And then also something called the dawn phenomenon. So people have a surge in hormones early in the morning, whether you have diabetes or not. So it can make it hard to control your blood sugar for someone with diabetes. So why should you take your blood sugar and manage it? So if your blood sugar is left unmanaged or uncontrolled, it can lead to other health complications. So, type 2 diabetes can increase your risk of developing complications such as cardiovascular disease, atherosclerosis, stroke, peripheral artery disease, and chronic kidney disease. It can cause damage to nerves, causing a condition called diabetic neuropathy, which can lead to numbness in the hands and feet. Nerve and blood vessel damage to the feet can cause issues as well, where minor cuts and blisters can lead to ulcers, infections, and amputations in serious cases. Kidney damage can also occur, which can affect how efficient your kidneys remove waste and extra fluid from your blood. Uncontrolled blood sugar over time can damage that, which can lead to the need for possible transplant or dialysis. It can cause eye damage, such as glaucoma, cataracts, or possible blindness. Skin and mouth conditions like infections and gum disease. And poor blood sugar control also appears to have some effect on the risk of developing Alzheimer's and dementia. So it is time to sound the alarm on diabetes and the rapid growing number of cases. 1.5 million Americans are diagnosed with diabetes every year. With the current diagnosis rate, the CDC projects a significant increase in diabetes in the United States, with the number of adults being diagnosed with diabetes potentially reaching 60.6 million by 2060. If you remember earlier in the presentation, the current number of Americans with diabetes is 39 million. So that is a projected 43% increase, meaning 1 in 3 people in the United States could possibly be diagnosed with diabetes. In 2023, an estimated 8.4 million adolescents, or 32.7% of age 12 to 17-year-olds, had prediabetes, which is nearly 1 in 3 adolescents. People 45 years old with prediabetes have a 10% chance of developing type 2 diabetes within 1 year, and a 50 to 70% lifetime risk of developing type 2 diabetes without any sort of lifestyle intervention. Fortunately, improvements in diet and exercise habits and loss of excess weight can help delay or prevent type 2 diabetes. Research has shown that people with prediabetes who lose 5 to 7% of their body weight and exercise about 30 minutes a day can reduce their risk for developing diabetes by 60% in 3 years. So now we'll talk a little more about those lifestyle changes specifically. Our eating habits play a large part in our blood sugar. So we'll go through some guidance on how to make a diabetic friendly plate. So we'll follow the guidance from the plate icon to the left. So we'll start with a 9-inch plate and fill half with non-starchy vegetables. These vegetables keep us feeling fuller longer and provide you with great tasting nutrients your body needs without as many calories and carbs. Non-starchy vegetables include broccoli, asparagus, cauliflower, Brussels sprouts, and many more. So we'll fill 1/4 of our plate with lean proteins. These can look like chicken, turkey, eggs, tuna, or cottage cheese. And we'll fill that last quarter with quality carbs, such as a starchy vegetable, fruit, or whole grain. So examples of these include brown rice, oatmeal, green peas, potatoes, or black beans. And to finish the plate off, we'll have water or a low-calorie option like unsweet tea or sparkling water without added sugar. So you might be asking yourself, how about physical activity? Regular physical activity plays a crucial role in preventing diabetes. Engaging in exercise has been shown to decrease the chances of developing diabetes by 58% in high-risk individuals, such as those with prediabetes. Individuals who meet the recommended 150 minutes of moderate intensity exercise per week are 4 times as likely to have normal blood sugar levels compared to those who exercise less. Activity not only aids in weight management, but also helps improve insulin sensitivity, reduces blood sugar levels, and lowers your risk for developing type 2 diabetes. So you might be thinking, how do I start this physical activity routine? So we want to start slow and gradually increase the intensity. If you're new to exercise, start with short sessions of low intensity activities, gradually increasing the duration and intensity over time. This approach reduces the risk of injury and keeps you motivated. We also want to set realistic goals. So setting achievable goals and tracking your progress. So you want to start with small milestones and celebrate your success along the way. This positive reinforcement will keep you motivated and committed to your exercise routine. And we want to find activities we enjoy. So choose activities you genuinely enjoy to make exercise more fun and sustainable. Whether it's dancing, hiking, cycling, or playing a sport, finding something you love will increase your likelihood of sticking to it in the long run. We can also incorporate physical activity into our daily routine. So look for opportunities to be active throughout the day, like taking the stairs instead of the elevator, walk or cycle instead of driving short distances, or engage in household chores that require physical effort. These small changes can add up and contribute to your overall physical activity level. We also want to seek support. So engage in physical activity with friends, family, or join an exercise group or class. Having a support system can provide motivation, accountability, and make exercise more enjoyable. Your Symbol Health Coach is also always here to offer you support and encouragement with achieving those goals. If lifestyle changes, such as losing weight, healthy eating, and engaging in regular moderate physical activity, aren't managing your blood glucose levels, you may need medication to help reduce them and your risk of heart disease and stroke. There are different types or classes of drugs that work in different ways to lower your blood sugar. People newly diagnosed with type 2 diabetes are prescribed metformin as a frontline therapy in addition to lifestyle changes. Metformin decreases the amount of glucose made by the liver. If you have additional risk factors for cardiovascular disease and lifestyle changes and metformin are not controlling your blood sugar well enough, additional medicines may be needed.
See ya.
Your healthcare professional may add an GLP-1 receptor agonist or an SGLT2 inhibitor to your regimen. A GLP-1 receptor agonist helps release insulin when you need it. It lowers the amount of glucose made by your liver. And an SGLT2 inhibitor works by blocking the reabsorption of glucose in the kidneys, leading to increasing glucose excretion in the urine. And then we also have insulin. Insulin is used in type 1 diabetes because the pancreas does not produce its own. It can also be used in type 2 diabetes when not enough insulin is produced by the pancreas. Though several pharmacological approaches can reverse prediabetes, lifestyle modification provides the strongest evidence for effectiveness. So now we'll do a little engagement with the crowd. So we'll go over some myths and facts.
Rebecca, can I stop
Yes.
you real quick? Is anyone else not seeing the slides change? I had one person. Just want to make sure before we do the myth or fact. But I mean, I see it. I see it
Okay.
fine.
So our first, we'll go. If I take my diabetes medication, I do not have to worry about my diet or exercise habits. So you can answer in the chat if you'd like. So, correct. It is a myth. Medication, healthy nutrition, and physical activity are all important to work together to control your diabetes. So, our next one, you will automatically get diabetes if you have prediabetes. So, what do we think about that one? Yes, that is also a myth. Prediabetes is a warning, not a destination. Making lifestyle changes can prevent or delay type 2 diabetes. So, we have one more. So, myth or fact, you cannot eat carbohydrates with prediabetes or diabetes. Correct. They were all myths. So, you don't have to eliminate carbs entirely. Instead, focus on healthy carbs like those found in whole grains, beans, fruit, and vegetables, which are good sources of fiber and help manage our blood sugar. So, whether you need assistance managing your diabetes or interested in setting goals and need accountability, Symbol is here to help. We offer free primary care visits, free diabetic supplies like blood sugar monitors, strips, or lancets to help you check your blood sugar. Also offer certain free medications. We also have free lab testing, like having your blood sugar checked or the A1C test we mentioned earlier, which can be done in the clinic and you can have results in a matter of minutes. Last but certainly not least, we offer free on-the-clock health coaching. So you and your personal health coach can set goals, track your progress, and help prevent or manage any chronic conditions like diabetes. So thank you all so much for watching my presentation. I hope you found it helpful and informative.